Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here once again with Dr. Zahra Figueredo. How are you, doctor?
Hi, Louise. I'm awesome. Thank you so much. I'm here in beautiful Vancouver.
You're still in Canada. Wow. I thought you were back.
Yes.
Well,
Nope, I'm here for several weeks. Yes.
Well, you sound very close, so that's why I'm asking. So, doctor, we do have a very interesting topic this week, which is stem cells for diabetes. In this case, how exactly the stem cells can help a diabetic patient, or what does the stem cells do to a diabetic patient?
You know, that is such a relevant question, Louise, because diabetes is sadly so prevalent, and the the fatalities and the mortality rate with diabetes is so high, and it's only rising. So what we can do, depending on the type of the type of diabetes. So the main two types of diabetes are diabetes type 1, which is usually a juvenile onset, insulin dependent, and then there's a type 2, which is usually later onset in life, and it's an insulin resistant. Insulin isn't always required in the later onset. And then there are other types of diabetes, but we'll stick with the main ones that most people fall under. So one is the type 1, where it's the pancreas, the delta cells in the islets of Langerhans area of the pancreas. What happens is that these cells are not producing insulin. So they're basically antibodies that attack these cells and cause the destruction of these cells, so that the cells cannot make enough insulin in response to blood sugar. Okay, when we eat our carbohydrates, our blood sugar rises, and the insulin will rise in response in order to allow the insulin to be taken up by the cells. And so when that doesn't happen, when there's not enough insulin to do that, we have a high blood sugar, and patients require insulin in those situations. Now, with diabetes type 2, patients don't necessarily require insulin because the insulin is there, but the cells are not responding to the insulin. That's what we mean by insulin resistance. And so in those cases, science and scientists have not been able to figure out exactly what the phenomenon is. However, it is pretty sufficient to say that as the body, the fat cells become bigger, which is what happens with as we age and as we gain weight or gain fat, the stem cells are growing in size. Okay, not the numbers. The numbers are set for life, but the stem cells are growing the fat cells are growing in size and accumulating more fat. And as that happens, the cells become more insulin resistant. And that's a theory, a very viable theory. And we see that as a patient loses fat, the insulin resistance becomes better. They start to respond better to insulin, and the blood sugar drops. So now, going back, I wanted to give a little bit of that background because it's really important for patients to understand what's going on when diabetes is happening. So what happens with stem cells is, for the type 1, we're trying to accomplish two things with type 1 diabetes and stem cells. We're trying to shut off that autoimmunity, those antibodies that are attacking the pancreas cells that make insulin. So we're trying to shut that autoimmunity off. And at the same time, we're trying to regenerate the damage that's been done. So regenerate those cells, those delta cells of the islets of Langerhans, in order to start producing insulin. Can we accomplish that with stem cells? You bet. Okay. We have done it. We have, within weeks of treatment, we have reduced the need for insulin. Many times we may need a follow-up treatment, but we have reduced the need for insulin enough to the point where controlling with diet and exercise, we have eliminated the need for insulin in a type 1 diabetes, patient with diabetes. Now, with patients, and we combine with these stem cells, we use endometrial stem cells with autoimmune conditions like diabetes. We use endometrial combined with umbilical cord and or bone marrow stem cells, autologous bone marrow stem cells, which is a very, very unique and effective combination. So that's what we do for type 1 diabetes. Now with type 2, and this is all IV and local injections as well. And now with type 2, we do something very similar, but we also ensure that we're addressing lifestyle with type 2, because it's really important that patients understand that there is a lot of inflammation going on. There is a lot of, because of the blood sugar issues, and we need to address these with lifestyle changes also, along with the stem cells, to have the best and permanent results.
So, in a few words, we can say that the stem cells regenerate the pancreas?
Yes, with type 1 diabetes. And then with the type 2 diabetes, the stem cells can regenerate all the other inflammatory tissues and help with reducing blood sugar by combining it with lifestyle changes.
In case...
And actually, and key supplements, there's really important that there are some key supplements provided with this treatment.
And with this treatment, can we say that it can also reduce the use of insulin?
Oh, yes, absolutely. So the decrease or eliminate the use of insulin and or any other medications, metformin, biliary, whatever medications the patient may be on in controlling blood sugar, we have reduced or eliminated the need for it. In fact, we have a patient, Jordan Williams, a UFC fighter, MMA. I'm sure a lot of our listeners have heard of him. We did stem cell treatment for him at type 1 diabetes, and within 5 weeks, we reduced his need for insulin by a third, and that was within 5 weeks of treatment, which was quite phenomenal. And he continues to get better. And so we're...
And you know what? Something that I noticed about that MMA fighter, that after he had done the stem cell treatment, he had a tattoo placed on his body with the stem cells. Did you notice that?
That's right. Yes, that's quite phenomenal.
So if you place a tattoo on your body, I think the effectiveness is real. For right. Sure. That was funny. I noticed that he did a tattoo on his body with the stem cells. Wow. So this is awesome news for diabetics. So, doctor, what does the treatment entail? Did you include any other treatments besides the stem cells?
Yes, yes. Thank you, Luis. Thank you for asking. We talk about these the adjunctive treatments quite often in our podcast, but for those newer listeners, I'm happy to reiterate and to clarify and add that our whole comprehensive treatment package includes very different modalities in order for the best possible results. Now, why we do this is in order to provide an environment and a milieu in the body for accommodating the stem cells in the best manner possible. So what we do is we start with a nutritional detox program. We call it the Total Detox Program, which includes a nutritional IV with antioxidants and B vitamins and vitamin C and It's just a beautiful, well-rounded nutritional cocktail that helps the liver and the portal system to detox. Okay, number one. And it's combined with B vitamin shots as well as organic coffee suppositories that are proprietary for our clinic. We combine the detox, the total detox program with oxygen therapy, either in the form of hyperbaric oxygen or exercise with oxygen, depending on the patient's limitations. We like to do the exercise with oxygen therapy if the patient is able to ride a bike for 20 minutes, a stationary bike, um, while they're breathing in oxygen from an oxygen concentrator, because it's only a 20-minute stint on a stationary bike without having to be in a hyperbaric chamber for 90 minutes. And so that is the option of choice if we can use that modality for a patient, again, depending on their limitations. And then we also combine that with the age-appropriate growth hormone therapy, as well as for a limited time, as well as the stem cell enhancement formula, which is a proprietary combination of key minerals and herbs, again, to help the stem cells to keep them sort of chugging along, as well as creating this environment in the body. All of these create this environment in the body of rejuvenation and healing. And that's what our aim is in order for the stem cells to do their best possible work.
Excellent, doctor. I don't know if you want to add something else to this podcast.
Yes, Louise, I failed to mention that along with these modalities, what also makes us very comprehensive and sets us apart from other clinics and why we have such phenomenal results is that we also address a patient's emotional, psychological, and spiritual well-being, which is such a huge part of healing. Our wellness is not just our physical body. It's also our emotional, as I mentioned, these esoteric aspects, stress, what is our attitude in life? There are so many factors that aid in our healing, and mindset and spiritual wellness and psychological wellness, emotional wellness is so important. And we address that with each and every patient also in order to get them in the best form possible for healing. Just the way we prepare the physical body for healing, we prepare the other aspects of our wellness for healing as well.
Excellent, doctor. So if you want to contact Dr. Zahra Figueredo, you will find all the information by the end of this podcast. And you can send us an email, you can contact us by WhatsApp, and you can also watch all the social media, all the information we have put up on videos on our YouTube channel. Everything is on the end of this podcast. So, doctor, I appreciate your time and enjoy your time in Canada.
Thank you so much, Louise. You have a beautiful day, and we will talk to you next week.
Okay. You take care, doctor.
Thank you. You too. Bye-bye.
If you want to contact us at the Stem Cell Healing Institute or Dr. Zahra Figueredo, you may do it by calling us. In North America, you may dial +1 209 690 7836. Also, if you want to write us by WhatsApp, you may add +502 4220 7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If If you want to watch our videos, please go to Dr. Zahra Figueredo. That is on YouTube. Thank you.